What's up, you guys? Rex here. A little bit different of a video for you today. I have the great privilege of sharing with you a presentation from the American Lung Cancer Screening Initiative. So without further ado, enjoy.
Hello everyone, my name is Priyanka Santo and I am a member of the American Lung Cancer Screening Initiative, or ALCSI as we like to call it. Today we will be giving a presentation on lung cancer and lung cancer screening. We are grateful for the opportunity to present to you today. Before I get into the content of the presentation, I'd like to share a little bit about what the American Lung Cancer Screening Initiative does. ALCSI is a 501c3 nonprofit that works to raise awareness for lung cancer and lung cancer screening. We are a team of over 50 passionate students and doctors located across the United States. We've worked with community organizations like the South Asian Network and American Indian Cancer Foundation, as well as city and state health departments, including the New York City and Connecticut health departments. We hope that in educating communities about lung cancer and lung cancer screening, high-risk community members will be encouraged to seek lung cancer screening. If you're interested in learning more about ALCSI, we'd like to invite you to visit our website at www.alcsi.org, and please email us with any questions at any time. Today, we'll be discussing both lung cancer and lung cancer screening, addressing questions such as how common is lung cancer, what is lung cancer screening, and how can you get screened? To start things off, lung cancer is very common. It is the second most common cancer in the US, excluding skin cancer. It is also the most fatal. This graph shows the American Cancer Society estimates for the number of new cancer cases in the United States. This graph estimates new cancer cases in 2020 for the 4 most common cancers. As you can see, it was estimated that 228,820 people were diagnosed with lung cancer in 2020 in the US. To put this number into perspective, it is estimated that about 6% of people will develop lung cancer during their lifetime in the United States. That means 1 in every 15 men and 1 in every 17 women will be diagnosed with lung cancer. Moreover, not only is lung cancer very common, it is also very fatal. Lung cancer is a leading cause of cancer-related death in the US and the world. In 2020, it was estimated that lung cancer claimed the lives of 135,720 people. This graph shows the American Cancer Society estimates for the number of new cancer-related deaths in the United States. As you can see, lung cancer is far more fatal than breast, prostate, and colon cancer, causing more deaths than all 3 of those combined. Every year, there are about 50,000 more new cases of breast cancer, but lung cancer causes over 90,000 more deaths. In women alone, every year, lung cancer causes more deaths than breast cancer, ovarian cancer, and uterine cancer combined. If we look at lung cancer incidence and mortality by sex and race, you can see that among males, lung cancer incidence is highest in Black males at an incidence rate of 71.7 per 100,000 people. Among females, lung cancer incidence is highest in white females at an incidence rate of 44.7. Mortality rates, as you can imagine, mirror incidence rates. So Black males have the highest mortality rate among males, while white females have the highest mortality rate amongst females. So from this data, the question that arises is, why is lung cancer mortality so high? Well, lung cancer mortality is so high because patients are typically diagnosed at a later stage. This graph is looking at the proportion of patients with lung cancer by stage. Stage is simply a way for doctors to classify a cancerous tumor based on tumor size, if the cancer has spread to lymph nodes, and if the cancer has spread to other locations in the patient's body. Currently, most lung cancers are diagnosed at a distant stage, when the cancer has spread beyond the site in the lung where it originated. This graph is based off of data from 2008 to 2017, published by the National Cancer Institute. As you can see, about 21% of patients are diagnosed at a localized stage, while about 51% of lung cancers are diagnosed at a distant stage, when the cancer has spread to other locations in the body. So why is this important? It's important because the stage that lung cancer is diagnosed at correlates directly with survival. And we'll see this in the next slide. One way that doctors track the survival of patients is by looking at the 5-year survival. As you can see here, the 5-year survival for lung cancer at the early stages is high, but the 5-year survival significantly drops as the disease progresses. This graph is another way to understand the relationship between the stage at diagnosis and 5-year survival. The 5-year survival for patients with localized lung cancer is 59%, but only 23% of lung cancers are diagnosed at that stage. In comparison, nearly half of lung cancers are diagnosed at a distant stage. And this is why early detection of lung cancer is so important. If we can detect lung cancer at an early stage, then treatment options are better and prognosis is better. With lung cancer being such a morbid disease, some of you might be wondering why the majority of lung cancers are diagnosed at a later stage. Well, the majority of patients are diagnosed with late-stage lung cancer because they don't start feeling any of the symptoms of lung cancer until the cancer has grown and spread. The most common symptoms of lung cancer are chronic cough, coughing up blood, chest pain, and shortness of breath. Some additional symptoms may include hoarseness, loss of appetite, fatigue, persistent lower respiratory infections, and a new onset of wheezing. However, when people become symptomatic, the cancer has grown and spread to a point where it is more difficult to treat and the prognosis is poor. If the diagnosis of lung cancer has to wait until a patient has symptoms, it is difficult to catch the lung cancer early. So the question we ask is, how do we catch lung cancer early if patients are asymptomatic? One of the best ways we can do this is through lung cancer screening. Lung cancer screening is done using something called the low-dose computed tomography scan. If you're eligible for lung cancer screening, it is recommended that you get annual lung cancer screening. In the coming slides, we will discuss what lung cancer screening is, who should get screened, and how to get screened. An important distinction we want to make is that lung cancer screening is done using low-dose computed tomography, also known as low-dose CT, and not the chest X-ray. We use low-dose CT scan because it provides more detailed pictures than chest X-ray, and it is better at finding small abnormal areas in the lungs. The picture on the left is a picture of a chest X-ray. The yellow arrows point to the abnormal area in the lungs, but as you can see, it is a bit unclear. On the other hand, the image on the right is a picture of a low-dose CT scan of the chest. The red arrows point to the abnormal areas in the lungs. And as you can see, this image is more detailed than the chest X-ray and enables you to see the abnormal area clearer. The question that researchers wanted to answer is, how effective is the low-dose CT scan at detecting lung cancers at an early stage? An important lung cancer screening trial called the National Lung Cancer Screening Trial, or NLST, tried to answer this very question. The NLST was a large national study with over 50,000 patients. The goal of the study was to determine the effectiveness of using a low-dose CT scan to detect lung cancers in patients considered high risk for lung cancer. So the study included two groups, a group of patients who received annual low-dose CT scans and a group of patients who received an annual chest X-ray. By comparing the stages at which cancers were caught between these two groups, the study wanted to determine if the low-dose CT scan was better at catching more lung cancers at an early stage. As you can see, of everyone diagnosed with lung cancer, the low-dose CT scan caught the most cancers at an early stage, while the X-ray diagnosed more patients at stage 4. This has important implications for survival. Because a low-dose CT scan caught more lung cancers at an early stage, these cancers were therefore more likely to be treatable, and the prognosis was much better. This translates to a 20% reduction in mortality for those who underwent lung cancer screening using low-dose CT compared to one chest X-ray. A concern with any screening test is accuracy. Essentially, how good is the low-dose CT scan at catching lung cancers? For every 100 individuals undergoing CT screening, 75 will be negative. Of those 75 that are negative, 97.7 to 100% truly do not have lung cancer. This means that the test is very good at identifying patients who do not have lung cancer. That is, if you do have lung cancer, the test will most likely come back positive, and the test will not miss your cancer. So if we move our attention to the 25 individuals that are positive, 23 turn out to be negative for cancer primarily with follow-up imaging alone. This means that even if your test result is a false positive, it is really easy to rule out cancer using further non-invasive imaging. The 2 individuals that have a positive test result and truly do have lung cancer are more likely to be diagnosed at an early stage than if they were not to undergo lung cancer screening. This means that their treatment options and prognosis are still much better. The results of the NLST were published in 2011, 10 years ago. Several studies have been published since then, further confirming a life-saving benefit of lung cancer screening in high-risk populations. And one of the most important is the Nelson trial. In February 2020, the results of the Nelson trial were published. Like the NLST, the Nelson trial also had 2 groups. However, unlike the NLST, the Nelson had a group that received low-dose CT scans and a group that received no screening of any kind. A total of 13,195 men and 2,594 women between the ages of 50 and 74 were randomly assigned to undergo CT screening at T0, which is baseline, year 1, year 3, and year 5.5, or they underwent no screening at all. The results confirmed the life-saving benefits of lung cancer screening by low-dose CT. In the screening group, 58.6% of lung cancers were diagnosed at stage 1. In the non-screening group, only 13.5% of lung cancers were diagnosed at stage 1. Early detection translates to a reduction in mortality. In the low-dose CT group, there was a 24% reduction in lung cancer mortality in men and a 33% reduction in lung cancer mortality in women when compared to no screening. So the Nelson trial also showed that with improvements in low-dose CT technology, the false positive rate could be reduced significantly. So just to summarize, lung cancer screening significantly reduces lung cancer mortality. But who should get screened for lung cancer? The United States Preventative Services Task Force, also known as the USPSTF, sets guidelines for who should be screened for lung cancer. Right now, they recommend that people between the ages of 50 to 80 who have a 20-pack-year smoking history or greater, and who are current or former smokers who quit within the past 15 years get annual low-dose CT scans. The current screening guidelines require you to have a 20-pack-year smoking history. Now, pack-year is probably a term that most of you have not heard before, but it is just a way for doctors to track your smoking history over a period of time. A pack year is defined as smoking a pack of cigarettes per day for a year. So, for example, if you were to smoke 1 pack a day for 20 years, that would equate to a 20-pack-year smoking history. Alternatively, if you were to smoke 2 packs a day for 10 years, that would also equate to a 20-pack-year smoking history. The important takeaway is that there are many different ways to reach a 20-pack-year smoking history, and the pack year is simply a way for doctors to keep track of your smoking history. I'd also like to point out that the USPSTF guidelines were recently updated. The USPSTF had slightly different guidelines about 3 months ago and updated their screening guidelines on March 9th, 2021. The previous screening guidelines only recommended that individuals between the age of 55 to 80 with a 30-pack-year smoking history or more get screened. Under the new guidelines, the lower age bound is lowered from 55 to 50 years, and the pack-year smoking history is lowered from 30-pack years to 20-pack years. These new screening guidelines will nearly double the number of eligible individuals for lung cancer screening in the United States. Notably, the most apparent increases in eligibility will occur among women and minorities. However, while these new guidelines will include more high-risk individuals, they only include individuals with heavy smoking histories, as we saw. There are other risk factors for lung cancer that are not accounted for in the current screening guidelines. These additional risk factors include things like exposure to secondhand smoke, exposure to radon, exposure to asbestos, family history of lung cancer, COPD, and previous radiation therapy to the lungs. It is important that we recognize these additional risk factors because while lung cancer has a strong association with smoking, there are a large number of people in the United States who have never smoked that still get lung cancer. Never smokers are defined as individuals who have smoked less than 100 cigarettes in their lifetime. Because lung cancer has such a strong association with smoking, people are often surprised to learn that lung cancer in never smokers accounts for about 10 to 20% of lung cancer diagnoses and is the seventh leading cause of cancer-related death in the US and the world. More never smokers die from lung cancer each year than people die from ovarian cancer. That is really astonishing. This graph shows the proportion of lung cancer cases that occur in people who have smoked in their life and people who have never smoked. It is then further broken down by whether they are a current smoker, former smoker, or a never smoker. As you can see, 80 to 90% of lung cancers occur in people who have smoked during their lifetime, and about 10 to 20% occur in never smokers. Interestingly, women are more likely to be never smokers when diagnosed with lung cancer. In fact, in the US, 60 to 70% of never smokers diagnosed with lung cancer are women. Right now, lung cancer screening is not recommended for individuals who have never smoked. However, understanding lung cancer in never smokers is a current focus of research. With the development of new screening technologies and risk models, there may be a way to identify high-risk never smokers who should be screened for lung cancer. In summary, lung cancer is the leading cause of cancer-related death in the US. It is so deadly because most lung cancer is diagnosed at a late stage when they've already spread to other locations in the body. Importantly, early detection through lung cancer screening by the use of low-dose CT can reduce lung cancer mortality by up to 33%. Currently, only 5.7% of high-risk individuals are currently getting screened for lung cancer. To highlight how low this number really is, we compare the lung cancer screening rate to the screening rates for breast, cervical, and colon cancer. All four of these cancers have screening tests that are recommended by the USPSTF. Right now, only 5.7% of high-risk individuals are getting screened for lung cancer. This rate is extremely low in comparison to the screening rates for breast, cervical, and colon cancer. The American Lung Association estimates that if we were to screen every high-risk individual recommended by the USPSTF in the US, we would save 48,000 lives. However, we are only screening 5.7%, which means that a lot of lives that could be saved are not being saved. And why is that? The lung cancer screening rate is low for a number of reasons, including limited awareness and concerns about access to screening. Additionally, factors like the cost of screening and the safety of screening also play a role. In the next slides, we will discuss each of these topics. The important takeaway, though, is that lung cancer screening can help reduce an individual's risk of dying from lung cancer. The first potential concern we will address is the cost of lung cancer screening. The average low-dose CT scan costs anywhere from $300 to $400, but most insurance companies, including Medicare and Medicaid, will cover the cost for eligible patients. However, there are a few exceptions. One, Medicare will only cover lung cancer screening until the age of 77. Two, not all state Medicaid plans cover lung cancer screening. And three, patients will still pay the usual fees for provider appointments before or after the scan. As I just mentioned, unfortunately, not all state Medicaid plans cover lung cancer screening. Here's a map updated in July showing which state Medicaid plans do and do not cover lung cancer screening. Blue states have state Medicaid plans that cover lung cancer screening, and purple states do not have Medicaid coverage. And the pink states are those states where we do not have this particular information. So the first step to getting a patient screened for lung cancer is having them talk to their primary care provider. There are certain questions a primary care provider has to ask and topics that have to be discussed. One of these is the patient's pack-year smoking history, which we saw how to calculate in earlier slides. To find accredited lung cancer screening centers, patients can go to the American College of Radiology website. They can type in the state or city they live in to see where accredited lung cancer screening facilities are located near them. The American College of Radiology website is listed on the bottom left-hand side of the screen. This is a map of accredited lung cancer screening facilities in Massachusetts. As you can see, each red pin represents an accredited lung cancer screening center. As far as the experience of getting a low-dose CT scan goes, it will require you to lay on your back for about 5 minutes. You'll be doing something very similar to the patient in the photo here. One thing to note is that this process will not hurt at all, and because it is a low-dose CT scan, you do not use contrast. This means there will not be any needles involved or injections. The low-dose CT scan is non-invasive, fast, and completely pain-free. Additionally, the amount of radiation exposure is very low. A way that doctors measure the amount of radiation a patient may receive is through a unit called the millisievert. It is just a way to measure radiation and compare the levels of radiation received during different activities and over time. For a low-dose CT scan, you will be exposed to 1.5 to 2 millisieverts of radiation. This is a lot lower than a full chest X-ray, which requires a radiation dose of 8 millisieverts. To put that in perspective, you are exposed to 3.11 millisieverts of radiation a year just from breathing, cosmic radiation, eating, and radiation from the earth. So a low-dose CT scan exposes you to less radiation than you're exposed to from just existing on Earth, which means that the level of radiation you receive from an annual lung cancer screening test is very small. That being said, this is always something that patients can discuss with their primary care provider. So a patient talked with a primary care doctor, and the PCP referred the patient to a screening center, and they received a low-dose CT scan. So what's next? The doctor will receive the results of the patient's screening test and will follow up with the patient to go over the results. As far as results go, there are 3 most likely outcomes. The first outcome is that the scans are normal. If that is the case, then the patient should look to get repeat scans in a year. If the scans are abnormal but probably benign, then the patient should talk to their doctor about the next steps. This may include more scans, tests, or biopsies. If the scans are abnormal and suspicious, then the patient will likely have to undergo additional testing such as a biopsy. So lung cancer screening saves lives. But a question you may be wondering is, can individuals still get screened for lung cancer during the COVID-19 pandemic? And is it safe to do so? During the pandemic, the number of cancer screenings has decreased significantly. However, lung cancer won't stop because of the pandemic. If a patient is at high risk for developing lung cancer, it is important that they get their annual lung cancer screening test. Right now, most hospitals have operating lung cancer screening programs, and patients can wear a mask during the entire lung cancer screening process. If a patient follows the necessary precautions like wearing a mask, lung cancer screening during the pandemic is safe. The pandemic should not deter patients from getting screened for lung cancer. Another question we get often is how vaping and e-cigarette use affects lung cancer risk. Vaping and e-cigarettes are relatively new phenomena and have become more prevalent in the last decade. While the long-term effects of vaping and e-cigarettes are still being studied, it is clear that for individuals who have never smoked before, they can increase their risk of lung cancer. E-cigarette devices and vaping fluids contain nicotine derivatives and heavy metals, along with other chemicals. These arise both as elements of the e-liquid and as a result of organic reactions in the electronic cigarette device. Various studies demonstrate that in vitro transforming and cytotoxic activity of these derivatives. Vaping causes fewer health risks than smoking, but it is not a risk-free activity. Vaping can increase heart rate, decrease air volume in the lungs, and increase airway resistance. Furthermore, e-cigarette device use has been significantly increasing, particularly among young adults and non-smokers, making it an area of significant concern for the future. Additionally, while lung cancer screening has the potential to save many lives, it is important to address smoking cessation in the context of lung cancer screening. Lung cancer screening is not a substitute for smoking cessation. Likewise, smoking cessation is not a substitute for lung cancer screening. Smoking cessation is one of the best ways to prevent lung cancer, and lung cancer screening is one of the best ways to detect lung cancer. So using both is the best way to fight the disease. For every year after an individual quits smoking, their risk for lung cancer is reduced by 8 to 17%, depending on the kind of lung cancer they have. Another reason that smoking cessation is important is because it is required by Medicare and Medicaid services for lung cancer screening programs. However, we do understand that smoking cessation can be difficult. There are a lot of resources for people trying to quit smoking. And some great programs are the renowned Health and Wellness Quit Smoking Program and the Cancer Coalition's Quit Smoking Program. As this presentation comes to a conclusion, we want to end on what we, the American Lung Cancer Screening Initiative, are doing to begin the widespread awareness, education, and advocacy efforts necessary to increase the lung cancer screening rate. Lung cancer is the deadliest cancer in the world. And while lung cancer screening can save so many lives, very few high-risk individuals are currently getting screened. We are working to address all aspects of this issue. We wrote and advocated for House and Senate resolutions expressing support for Lung Cancer Awareness Month and early detection through lung cancer screening. Last December, our Senate resolution was passed by unanimous consent. Additionally, we're working to teach communities across the country about lung cancer and lung cancer screening. Lung cancer, as we all know, is the deadliest cancer in the world. But by working together, we can overcome it and save millions of lives. It starts by working together to raise awareness and initiate lung cancer screening programs in our own communities. We believe that by educating these communities, especially students, about lung cancer screening, we can lower the number of deaths associated with the disease. Students greatly impact and influence the healthcare of their parents. And we hope that by educating students about important measures that can be taken, we will not only be able to help the students, but also their family members. We are so grateful to have had the opportunity to present to you today. Thank you for your time. We hope that you're able to leave this presentation with a better understanding of lung cancer and the lung cancer screening process. As we all know, lung cancer is a big problem. It is very common and very fatal. That being said, there are tools we can use and actions we can take to help reduce lung cancer mortality. And one of the best ones, and the topic of this presentation, is lung cancer screening. The American Lung Cancer Screening Initiative is always looking to help raise awareness for lung cancer and lung cancer screening. We host a variety of events related to lung cancer screening, and we share upcoming presentations and webinars on our website. If you have any questions, please feel free to send us an email. Additionally, if you're interested in helping raise awareness for lung cancer in your community, we would love to work together. Thank you for listening.
If you have any questions, comments, or concerns, leave them down below. If you want to catch more videos from me or other cool stuff that I share on this channel, make sure you subscribe, hit the notification bell. As always, like the video if you like the video, dislike the video if you dislike the video. Until next time, don't be ordinary, go be great.